Right, welcome back, everybody. So it's 7:15 here on the program. Now, following news that Gauteng Health MEC, Dr. Nomathemba Mokgethi, is currently in self-isolation at home after she tested positive for COVID-19, some have raised questions about the effectiveness of getting vaccinated against COVID-19. According to a department statement released last night, the MEC presented mild symptoms before she went to test. She had been one of the first people to receive the Johnson & Johnson vaccine under the Sisonke Programme in Gauteng, and she's reportedly not exhibiting any severe symptoms and will remain in isolation for 10 days. Dr. Fundile Nyati is a health expert and the chief executive of Proactive Health Solutions. He joins us now to chat about this. Good to have you. Thanks very, very much for joining us, Doctor.
Good morning, Leanne, and good morning to your viewers.
Let me start quickly, I suppose. Let me just get two big questions out the way. Firstly, the increase in infections that we're seeing, a little bit worrying. The figures are quite big today. I mean, we're just sitting below that 10% mark, which is very worrisome for government. I mean, what are your views? How do you think we're looking right now?
Look, officially, we are not yet, at the third wave. I'm talking about nationally. However, when one looks at some of the provinces, one could say in those provinces they have actually hit, the third wave. But nationally, we have not yet gotten there. What they say, that is the experts on the epidemiology side, they say, we need to, for us to declare a third wave, we must be at least at about a third of the peak that we had. So we're not yet there. However, we are getting very close. And so it is very worrying for the country that we are actually edging close to the third wave officially.
Certainly, I mean, the infection numbers are climbing, and also looking at the death rate, that's a little bit worrying as well when you look at a large amount of fatalities coming through as well. Let's now talk to our defense line of getting vaccines. People have been complaining that the rollout has been very slow. We saw this week phase 2 kick in. Again, just your overall impressions before we dig a bit deeper. How are you finding South Africa's vaccination process?
Look, when one looks at South Africa's vaccination, program, there's been a lot of issues that have taken place since the announcement in January. Some of the issues are, I would say, a little bit out of our control. For example, the countries that are developed nations that actually develop these vaccines, they actually imposed what we would call vaccine nationalism, which were making it difficult for developing countries like South Africa to access these vaccines because they wanted their people to get the vaccines first, whether we're talking the European Union, the UK, or even America. So I think that is one problem, access to the supplies. But the second problem was that there were things that we did not budget for. For example, what happened with the AstraZeneca vaccine, on the eve of that being rolled out, then data came out that showed that it is actually not so effective against the variant that was discovered here, which meant we then had to, scramble and find another solution. That solution was found in the form of the Sisonke trial, which was just for the healthcare workers. And obviously being a trial, it was not widespread across the country. It was only for healthcare workers. And that also made us to move very slowly. And then there was the J&J scare in the US where people out of 6 million, they got some clots in the brain. That also was a problem because we had to suspend. So there's all of those things. But having said all of that, the planning and especially public health education relating to vaccination, I think more could have been done. Even if the vaccines were not yet here, but the groundwork, the kind of communication that we normally see when there's going to be elections, national elections, that's the kind of thing that we needed. So in the vacuum, there's been a lot of conspiracy theories, and a lot of people have then, got sucked up by vaccine hesitancy. And that is the problem. So the biggest challenge now that the vaccines are here, is how do we ensure that people volunteer to take the vaccines? Because the vaccine hesitancy is still there. It doesn't help that some prominent people in the country also, ventured into this space and confused a lot of people. And so, I'm optimistic, but I think, more could have been done.
Yeah. So this is, let's talk to the vaccine hesitancy, because we do know, I mean, you've spoken about some of the stumbling blocks that have been in the way of South Africa pushing ahead with regard to getting lots of vaccines. I see now COVAX has also got a massive question mark on it because India are now diverting, they're the biggest suppliers with regard to COVAX, they are diverting their supplies to their people because they're in the midst of a massive wave, and we all understand that. But now that's also thrown a spanner in the works. So let's talk to vaccine hesitancy. I suppose a lot of people are looking and wondering, well, we see an MEC of Health getting COVID even though she's been vaccinated. Let's clear up a few myths here, because getting a vaccine doesn't mean you're never going to get COVID, because that, I think, is a very important thing we need to put across. If you do have the vaccine, it's just bringing the severity of how you get COVID. That is my understanding. Perhaps you can tell us more.
All right. I think let's start by simplifying it by looking at the flu vaccine, for example, the one that we get on an annual basis. If you get a flu vaccine, it does not mean you will not get flu. Many people will not get flu, but some may get the flu, but it might be a milder type of flu. So let's come back then to the COVID situation. None of these vaccines that have been announced since November, the first one was obviously the Pfizer one, and then the Moderna, and then AstraZeneca, and then J&J. None of them give you 100% protection against the infection. The best, is the Moderna and the Pfizer that give you 94-95% protection. But there's that 5% chance that you may be infected. Mm-hmm. Let's get then to the issue with the MEC. She took the J&J vaccine, and the J&J vaccine actually gives you somewhere around 64% protection, against a mild infection, but 85% protection against severe disease and death. So even there is that possibility that one can get, mild infection, because there's about 36% chance that you could get a mild infection, and maybe 15% chance that you can get a severe, disease. So these things must be looked in that context, that yes, she did get the vaccine. She was amongst the first people to do that, but obviously, that was not 100% protection. But we are also happy that the statement from the department is saying she got mild symptoms, which is exactly what we expect, that if you've had a vaccine, if you do get infected, then it will be a mild infection, certainly not anything that will take you to hospital for admission and be in ICU.
So here's an interesting one. I'm not sure if many people know about it, but the New York Yankees, they now are, as a team, they got vaccinated. 7th of April, I'm reading, they also got the Johnson & Johnson vaccine. Now, the New York Yankees, out of the entire team, 9 of them tested positive for COVID-19. This is right now, so they are positive right now. However, reading reports, and many people are looking to this as a sign that exactly what's been said is what goes on, is that of the 9 that are infected, 7 are completely asymptomatic, and 2 have very, very mild symptoms. So they're not, showing any sign of a severe illness. So this is a good example of the vaccine at play. It's not that you're not going to get it. It is how you react to it. So instead of the hospitalization, going on ventilators and getting very ill. So this is quite an interesting case study to look at the Yankees. So you can still get it, but are you infectious? I mean, spreading it is a problem, because we're living in a country where not many people have been vaccinated. So if you do have COVID, you're asymptomatic, and you're with a lot of people that haven't been vaccinated, there's where the problem comes in.
Yes. Now, again, I think what's also important there is to understand that, again, none of these vaccines that have been, approved actually are what we call like the sterile, type of vaccines, in the sense that there's 2 things one needs to understand. There is the infection, and then there is the disease. Okay? So the vaccines, they prevent you from actually getting, the illness. okay? But if you do get the illness, it's actually a mild illness. Now, but that does not mean you may not get infected and carry, that infection, and spread it around. So when we're vaccinating people, we're vaccinating them so that at a personal level, they get the benefit we've just spoken about, but also at a community level that, over time, then there's less spread of the infection. So when we reach that, population immunity, or what they call herd immunity, because many people have been vaccinated, and therefore at a community level, there's less transmission. So in a country like South Africa, where we have not really, done much in terms of vaccination, in terms of the numbers that we've done, we are in a country, therefore, where even if you've been vaccinated, but there is a possibility that you could be carrying the infection, and therefore the non-pharmaceutical measures must still be taken, into account, even if you've got the vaccine. But in a place like Israel, where the majority of the population has been vaccinated, or even the US for that matter, they have now said, look, you don't even need to wear a mask if you've been fully vaccinated. Being fully vaccinated means after 2 weeks that you have had the complete vaccine. So J&J, 2 weeks after you've had your single shot. For Pfizer, 2 weeks after you've had the second dose. Yeah. So in the South African context, we unfortunately are still at a point where very few people have been vaccinated. And therefore, even after you've had your vaccine, you're going to need to continue to practice those non-pharmaceutical measures, not only to protect self, but, others as well.
Very big thing. Final question, Doc, and very quickly, please, the gap between the Pfizer injections, because the recommendation was 3 weeks. Now, our government perhaps looking at the 6 weeks gap between them. Is this a little bit concerning?
Well, right. When they announced their findings of the phase 3 trials in November last year, they said, about 3 to 4 weeks, from the first to the second vaccine. But a country like the UK then also came in, and even with the AstraZeneca vaccine, and then they looked at, a longer period, because they wanted to vaccinate many people with at least the first shot. So what has come out really out of the studies is that, you can do a 6 weeks. And in some countries, they've actually looked at even 12 weeks as well. That is the UK. That is with the AstraZeneca. So I think whilst the manufacturer said 3 to 4 weeks, but there is no harm in actually, doing it at 6 weeks. So, and I'm sure that is, backed by scientific data, because the ministry is advised by experts on that.
All right. Dr. Nyati, thanks very much for your views. Thanks for chatting to us here on the program. Dr. Fundile Nyati is a health expert and also Chief Executive of Proactive Health Solutions, talking to us about the importance of being vaccinated and also, after having the vaccine, getting infected and with everything that goes with that. Right, we need to take a quick break. Headlines after this. Stay tuned.